things and one of my roles is me and my team work from the beginning through the whole transplant process with our families. So from the time you make the phone call to our center, you usually get in touch with myself or one of our coordinators. Even if it comes through Dr. Mazariegos or Dr. Soltis, they usually shoot us an email, and then we take it from there. There's some simple things we just ask them. I just want to make sure that the families are aware if the outside center is referring them before we call the families and start talking to them about something that they have no idea what's going on. So why families explore transplant? Well, you guys all know the reasons why. There are so many different reasons, and they're each individualized for every family. And so what we do is we have a phone call and have a conversation with the families like, okay, what got you to this point to reach out to us? What do you need from us? Are you ready, or you just want to talk about it? Kind of get an idea, a sense of what's been going on so we can better serve your purpose. What transplant changes in daily life? There's a lot of different things for a lot of different people. But what we do, being nurses that have the experience, we really want to advocate, and you don't know what you don't know. So we want to work with you. We do education with you when you come for your eval. It's usually about a 2-day process. We tell you all this on the phone when we make that initial contact with you, what to expect. You're going to come up for 2 days. You're going to meet a lot of different people. You're going to do a lot of tests, lots of conversations, but we're taking that time to get to know you, to make an individualized plan for you. What's going to be best for you? What's going to be best for your child? Somebody had asked about social work and behavioral health resources. Well, we have a transplant social worker that you will meet. She will work on, if you live a distance away, what's going to be your transportation plan? We have resources to give to you. Angel Flight, other different services that we use to get you here, so you're not by yourself. We also have our transplant psychologist that will sit down, work through things. She's going to follow you after transplant too. So when it's time to go to school, and if you need help with an IEP or anything like that, she's there to support you as well. We also have child life as an option. So if we know a kid has some issues with anxiety, doesn't like needles, doesn't like having blood drawn, we can incorporate that into the evaluation process and for your plan when you're admitted. So I think by taking the time as a nurse to sit down and go over all that education with you, with the patient present, it gives us our cues. So then when we go to clinic and we talk to the providers, we can say, hey, these were the things that the families asked us during transplant. So can you focus and make sure you answer these questions for them? Otherwise, they might forget, you guys might forget, there's a lot going on and a lot coming at you. But we want to be there and we want to advocate and make sure all your questions are answered. I think one of the big things, there's been a lot of questions having done eval teaching and meeting with families, just making sure that they understand, what changes and what really doesn't change, and what having a transplant is going to mean long-term for you. We allow the families, we include the families in all the conversations. We want you to have a full idea of what you're signing up for if this is the path you choose. As a nurse, we advocate for you. Want to make sure you realize the risks, the benefits, and how your life is going to change. The surgeons will go over the different options, what you would be a living donor versus a deceased donor, and we talk through that with you guys. What does that mean? If it's a living donor versus a deceased, how, I think I said to you today, it's like having a C-section versus going into labor. One's a little bit more planned, you have a date. The other one could happen at any time. So there's risk and benefits to both, and we explore those with you. One of the things over time, I've kind of compiled a list of frequently asked questions. That was the one about the multi-center listings. What does that mean? But it's really, what can I eat after transplant? What is the first thing that you would recommend? Bacon was usually one of the big ones. One of the nurses would always recommend. But it would be a real joy to sit there and watch kids try things for the first time. Ice cream sundaes, pizza, all those things that they couldn't eat before. A hot dog, right? All those things that weren't an option before. And part of the evaluation process is to let you have a clear understanding of what it's going to look like when you come in to be transplanted. So nothing's a surprise. So some of the things we get asked, is that really true? Does that really happen? It's possible. But we want to make sure that you have a clear understanding. You're going to be in the ICU. You might have this tube. You might have that. And then really what it means long term. So we don't forget about you after your discharge. We're still following up with you. We're working through things with you. We're contacting your primary team, getting records, communicating with you back and forth. All while, if there's concerns, very, very easy for us to reach out to our providers and say, hey, can you give this family a call? They have some questions that I can't answer as a nurse. We support your decision, even if it's not to proceed with transplant at this time. I will share a story. I had a geneticist reach out to me. She had a patient that was just recently diagnosed with MSUD, a baby, and family wasn't quite ready yet. They didn't know enough about it. And so just reached out to her and said, I'm here to give you education. I actually recommended this meeting for her to start attending, to get in touch with this group for support, and just reached out to her and said, what questions do you have? I can give them to my surgeon to answer them. Let me know when you're ready. We're not going anywhere. We're here. But it's all on your timeline because it's such a personal choice, such a personal decision. And we want to be there to support you throughout the way with our team, which is a dynamic team made up of all different disciplines that are really here to work with you guys to make sure you have an informed decision and know what's ahead of you if this is the path you choose. Questions?
I'll ask Stacey some questions.
Okay.
All right, Stacey, tell us a little bit about what you would expect patients about having to stay at their transplant center in the immediate time post-transplant. Just tell us a little bit about that.
So right after transplant, every patient goes to the ICU. And the amount of time that you spend in the ICU is really dependent upon a couple different elements. Usually it's a couple days, 3 to 4 days, but then afterwards you'll come up to the designated transplant floor and they will work with you to get to your goals to discharge, learning your medications, learning good diet habits, getting you up, getting you walking, all that kind of stuff. So we've had families that will stay at Ronald McDonald for a little bit of time, and then we have had some families that, because they had multiple children, they ended up going to an Airbnb, and the whole family came and stayed, and we have a list of, Pittsburgh's a pretty great city. I know we're in Cleveland, but there's a list of different things and activities that we can do. Child Life is pretty good at being able to get us zoo passes and whatnot, so we can keep, all the kids engaged. We want to make sure that the families take care of themselves as well. So it's a whole family thing too.
We have, and this may be the case at many of the modern children's hospitals, but in our ICU, one adult can stay with a child at any time throughout the entire stay, and in the floor, two adults can stay with the child in the room. These are primarily private rooms, so I think it is geared to try to be friendly to the family, both in the room with the parents staying, and then to support the family. We had one family that rented this van and had all 8 kids come up. It was amazing. So there's lots of different options available to you.
And we also have a sibling center too. So I think that's something, as long as the siblings are potty trained, they can book time to have them go down there. So some families have utilized that for when we know the physicians are going to round, so they don't have the other distractions of the other children. They can focus on that. And then even for outpatient appointments, if we know you're coming, we can book it in advance, so you're only bringing the patient with you to clinic, and they can go play in the sibling center that's staffed by UPMC staff, child life staff, and volunteers.
Kevin. Yep.
In recent years, have you had any authorization problems with payers for MSUD transplant?
No, I'm thinking in my head. Not that I know that it was diagnosis related.
I think one of the I'm not aware that we've had any challenges with getting transplant auth. We do have challenges once patients are adults and may return from out of state for local care, and how to transition, which center to properly have transplant follow-up for the adult patient is not always able to be done in Pittsburgh. And sometimes it's by choice, so there's families that want to be cared for at a transplant center for their adult care nearer to their home, which we support. And in most cases for liver transplant, there's a very suitable liver transplant program for adult transplant follow-up care that would be near their home. But we do need to pay attention to that, and we don't want patients to fall off the grid in that transition point from, say, age 16 to 25 or so.
How do overall recovery rates, the speed of recovery, and overall hospital stays typically vary with pediatric as compared to adult cases, if at all?
Great question. I think our length of stay is still about 19 days for liver transplant. And we haven't done a recent reanalysis of that, how that compared to MSUD. For smaller children, we want to make sure that there's not any wound closure issues and things like that. That may be a factor for very small infants compared to adults. Our recent patient was discharged after about 8 days in the hospital. So I think the hospitalization rates in general are falling. There was one question, I think, from the gentleman there. Yes. Yeah. What was the last thing? Transplant? Oh, vaccines, yeah. We recommend that you get your live vaccines on schedule, and so particularly in the infancy period, so the period from one year, from birth to 1 year of age. We do transplants at any age based on the indication. There was data from our analysis of metabolic patients that showed across the board in the United States, once a patient is in that 1 to 2 year range, that the outcomes by age don't differ. And so the data would suggest that if a child under 1 urgently needs a transplant, then we need to do that transplant, and it should be done. If there's some opportunity with stable metabolic care, then we discuss whether waiting to age 1 or between that 1 to age 2 range can be doable. As I was talking with others during lunch period, transplants in the pediatric age range, and that would really be anywhere in the 0 to 6 range, do have a tendency to be more likely to need less immunosuppression than adult transplants. We don't completely understand the reason why, but those patients who transplanted in that cohort have been a little bit more likely to be on low levels of immunosuppression than adults, certainly. Mm-hmm. We would recommend typically staying on the normal vaccine schedule and discussing that with your transplant team, and usually we try to keep on the normal schedule. If once a patient is transplanted, though, then we discuss the use of live vaccines, which haven't routinely been used after transplant, but there are some studies that those are being tolerated, and we are doing some live vaccines post-transplant period, so that's a change that's happened in the last 5 years. It's been both safe and efficacious to use some live vaccines in the post-transplant period. Once you're out of the immediate transplant phase and on a lower level of a bit more baseline immunosuppression. Okay.